Hey everybody, welcome to this episode of Compassion and Courage, Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast that teaches compassionate communication, provides perspective, and inspires resilience. So today I am joined by Nicole Rakowski. Did I pronounce that right,
You did, yep.
Nicole?
No, you got it
Okay,
right on the
thank you.
first try. I'm impressed.
Thank you, because that's not always the case with my Germanic upbringing in rural Missouri to be able to pronounce all names. So thank you so much for being with me today. And I was looking over your work, and I don't even know where to begin. I don't even know where to begin because your work first came to me through the barrel patient experience and the case study that you
Right.
wrote. But there's so many other major areas that I'd love to make sure we touch on today. So thank you for being with me. And can we start with, I guess, your patient story before we get into the professional work?
Absolutely. And I just want to take a moment just to thank you for having me on the show today. And,
Sure.
I know that we both endured, the patient experience. We both faced some sort of trauma or accident in our life. So, it's amazing to be able to meet someone with like-minded experience, and the opportunity to be able to be here today and speak about that is truly incredible. So I want to thank you from the bottom of my heart for inviting me to be
Sure.
on the podcast here today.
Well, absolutely. And I'm so excited to get your perspective. One thing I forgot to ask, I'm here in my home studio in Orlando. Where are you today?
So I am about an hour south of Toronto in Ontario, Canada. So outside of a little town called Hamilton, Ontario. So just
Mhm.
outside in Dundas, technically. So it's about an hour south of Toronto. So when we travel, we typically say we're from Toronto just because that's the major city that people know.
Excellent. Excellent. I think you may be the first Canadian that we've had on the podcast. So
Oh, wonderful.
welcome. Welcome.
Thank you. So, in sharing a little bit of background about my story, so I traveled to Iceland in February of 2017 with two of my good friends, and we were on a very challenging 1.5 hour hike. This is about on the second last day of our trip. To one of the most beautiful places just outside of the capital of Iceland. And it was truly the most breathtaking and scenic landscape that we had ever seen. So it's called Steam Valley in English. That's what it sort of translates to. But for many of you that know Iceland or have been to Iceland, the whole island is geothermal. And, you know, this area that we were hiking on, the Steam Valley, we could literally see the steam coming out of the holes in the ground. So it was a little bit of an indicator that this area is hot. It's perhaps certain areas that we have to watch. And the hike took us to this hot water stream that was flowing down a mountain range where visitors could essentially bathe. And there was a boardwalk along the side of the river, but there was no steps to get down to the actual river. So, sort of looking at different individuals, so bathers had to walk down to the bank, and out of my group of friends, the three of us that were there, so I was the first one to go down to the riverbank. And I had, taken my boots off, I had my bathing suit on, and I had stepped off of the boardwalk in my bare feet. And what I thought was a hard mud surface just walking in front of me looked like everything was sort of fine. And it was to my shock that I actually broke through and I sank up just past my shins in scalding water. And I knew right away that it was absolutely burning hot. And I started screaming at the top of my lungs that, I'm burning, I'm burning. I could feel it bubbling on my feet. It was like this hot and acidic mud, and I couldn't get out of it on my own. So I was sort of scraping at the mosses at the side. I was trying to pull myself out, but I really couldn't. And as I'm screaming there, I'm burning, help me. My two friends sort of ran over. They were sort of at shocked at first, not knowing what was going on, and they pulled me out and they dragged me away to the side of the river. But I was in so much shock, and I think they were as well. And I remember looking down at my feet, and I could see skin peeling away to the sides, and I just remember screaming in pain. It was truly one of the most excruciating feelings of pain that I have ever had in my life. And to continue the story, so there was no cell phone reception where we were, and there was no way to make a call for help. Both of my friends were sort of asking other hikers that ran over to help, but all that they really had were, small first aid kits, if anything, some band-aids inside, some polysporin, but definitely nothing to treat second and third degree burns. And at that point, I was really drifting in and out of consciousness. And eventually, more people came, others that had called for help. They were sort of gathering other individuals that were running over. And I was very lucky that one of them was actually a firefighter from California. And he was sort of used to these mountain terrain accidents. He was used to exploring, having this rescue sort of experience within him. So he sort of assessed the situation and stated that the only way I would survive is to get me out of that valley as soon as possible. So he started to carry me on his back. He showed others as well how to do the fireman's carry. So they sort of took turns carrying me. And I was essentially a dead weight, going in and out of consciousness. Like, I just remember asking, "Am I going to die?" And so these individuals were taking turns carrying me over the hilly terrain when this is by like complete stroke of luck. They came across this Icelandic teenager who was doing rescue training on the actual Steam Valley region, and he had a radio to call for help. So they attempted to get a helicopter in, but apparently it was too far away on the other side of the island, Air Orange, and would not have made it in time. So finally, there was a rescue team with ATVs that met us halfway up the trail, and they used these special baskets to get me down to the ambulance at the parking lot. And overall, it was about 2.5 hours from the time I was burned until I made it to the hospital in Iceland's capital, so Reykjavik. I remember while riding in the ambulance that I saw these two black clouds just closing in front of me. And I thought to myself that that's it. Like, this is what death feels like. This is what a near death experience feels like. And I woke up in the hospital right before the surgery, and everyone was speaking Icelandic. I had no idea if I would wake up and still have my legs or not. I think that was probably the most difficult because I had really no idea how things would end. I was going into the surgery, and, I really had no idea what the outcome was going to be. I ended up waking up from surgery, and once I was stable enough, I returned home on a flight. My legs were completely wrapped up in everything imaginable, and it was one of the most excruciating flights home. Everyone was very accommodating, though. I had a row to myself on the airplane, I had a nurse on board with me. So the flight home definitely took a lot of pre-planning, and I had individuals that met me. So my boyfriend at the time, as well as my mom, at the airport in Toronto, and they took me to the burn unit at our regional sort of burn hospital, which is the Hamilton General Hospital. And this is a tertiary care center that specializes in burns within the larger healthcare system in Southern Ontario. So Hamilton Health Sciences, which is what I work for as well. And then there I was treated for several weeks, followed by months and months of recovery. So that's basically the story in a nutshell.
Wow. So how long do you have an estimate of how long once you broke through until you were pulled out, how long you were actually in that boiling mess?
It's hard to predict, but I'm going to say probably 30 to 45 seconds. So,
30 to 45 seconds.
yeah.
Wow.
So you're just sort of, in that mud, acidic and burning hot sort of substrate, and you're trying to scrape to get out. It's, 30 to 40 seconds does not seem like a lot of time, but, having that
Oh.
sensational feeling of just burning constantly was a nightmare.
Yeah, yeah. I mean, you talk to many people and say, well, you think about what is the worst way to die, and
Yes.
some will say drowning, and some will say, well, fire. And
Yeah.
I just the idea of burning or of scalding like you went through, God, my heart goes out to you, and um, I'm so glad you're here to tell the story.
No, thank you, and likewise. And you're right in terms of from, hearing stories from other people, and I think burns is one of the most painful in terms of endurances. Although I, can't speak for other unfortunate events, but definitely something that was memorable and maybe not the best kind of way.
So, one of the questions that I always give to my pre-meds, and I'd like to make this a little more specific to this patient story that you very generously shared, um, is that idea of a time that someone was there for you. Was there someone who was there for you and who showed you compassion in those couple of hours that obviously people were medically helping you get around? And boy, what a stroke of good fortune, luck, or divine intervention to come across a firefighter trained in these types of, maybe not burns, but issues out on the trail and how to get people back. I just so during that process, do you remember anyone showing compassion to you, and if so, how?
Yeah, that's a great question. And definitely, I think compassion comes from so many different forms, and it's not necessarily just what is said to someone, but it's also what was done. And I think for me at that point in time, the most meaningful was that strangers that came together from all over the world, regardless of different barriers, to save my life. And I think it was really individuals teaming up from different areas of the world, not necessarily speaking the same language, not necessarily having the same values, but it was these strangers that had teamed up to save me, and strangers who were not seeking any sort of reward by engaging in this rescue mission, right? They simply wanted to help because they could. And it was at that exact moment in time that I realized, at least to me, that global health and patient experience took on a completely new meaning for me. It was not necessarily just in achieving equity or prioritizing sustainability outcomes or creating some sort of universal policies or procedures that we're sort of ingrained in when we work in healthcare on a daily basis. But I realized that it was truly beyond that. Like all those individuals that teamed up, it was about their heroic efforts, of those from around the world that stepped up and worked together. Like I mentioned, regardless of cultural, linguistic, or political barriers, these individuals were unconsciously able to put their differences aside, and they contributed to the heroic effort without asking for anything in return. Right. So I think this single
Yeah.
incident can be really paralleled by the power that countries can share when they join their efforts to overcome different global challenges.
A microcosm versus macro level view, right? If we're taking
Exactly.
care of those individuals who are hurting and suffering, if we can do that on an individual basis with a small group of people, can we not spread that to a global, I don't want to say audience, but you know
Mhm.
what I'm saying, a global population? Absolutely.
Absolutely. And
Yeah.
we have sort of seen that within the pandemic, right? And across the pandemic with COVID
Yeah.
19. And I think as I look back on this incident that took place nearly, 5 years ago now, I can't help but compare it to the biggest challenges that we were recently just faced with on a global
Yeah.
scale, and that is COVID 19.
Okay, so let's go back now to the professional side of things because you were working in healthcare before this trauma, correct?
Yes, that is correct.
And you've continued to work in healthcare with, especially in patient experience, using your experiences of this trauma to fortify your work in patient experience. That's full time work. And then
Yeah.
you're also a PhD candidate right now. Is that correct?
Exactly. Yep. That's another
So
component of my life.
yeah. So as I'm reading through all your things, I was like, well, how do you have time to sleep? But let's let's talk a little bit then about how you've been able to parlay your experiences to further develop that work of patient experience, and then how that plays into your academic journey as well.
Absolutely. So I think, this experience has definitely helped to shape the way I perceive different things. I've heard in previous roles. So at the time of my accident, I worked at Hamilton Health Sciences in the Communications and Public Affairs Department as an administrative resident. And during this position, so I would interview various members of clinical teams as well as patients and families, and I would share their stories and experiences of life changing injuries or illnesses. And I had heard about the physical and emotional challenges that came with that, but it was very hard to put myself in patients' shoes And, it was hard for me to imagine what it was like that they were going through. So, as a result of this accident, I found it significantly easier to empathize with traumatized patients after experiencing what it was like to be, on that side of the equation. And I didn't, realize the extent of what healthcare workers do until I needed, help with the simplest things like showering and getting dressed. So I think for me, the biggest thing is it changed my perspective and outlook.
How did it change your outlook and perspective about pain?
Yes, that's a great question. So I think that with pain, there is this sense of empathy and compassion that does not solely come from just learning about it. I think it comes from experiencing it on your own. And I know all of us have experienced pain to some degree or to some extent. Some have a greater tolerance, some have a lower tolerance, some have a greater magnitude of pain that they may have experienced for longer periods of time. For some of us, it's acute, for some of us, it's chronic pain, right? So I can't speak to necessarily all levels, but I can speak to having a traumatic injury and experiencing significant pain. And again, it's that sense of empathy and compassion that does not come from just learning about it in a course or from taking an e learning module or from watching a TED talk. It comes from experiencing that on your own. And it's to me that human side of patient care that cannot be taught in school. It can only be taught by those we care for or have a meaningful interaction with. So we might not be able to relate to every single situation of what a patient is going through, but we can work on our ability to understand how patients feel in order to build a sense of safety and improve the experience for them.
When I'm working with those who are at the bedside, I like to say, you remember going back to like psychology 101 in college
Yeah.
when we learned the whole, or maybe even earlier, when we learned Maslow's pyramids of basic needs all the way up to self actualization,
Yeah.
and I often say you can throw all of that out the window when somebody is in physical pain,
Yeah.
you because they don't want anything except to not be in physical pain and agony.
Exactly.
That and that's I think we're looking a little more these days too at how much that comes back to find us later emotionally, psychologically, right? Those pains that we endured. And so I guess I'm wondering too, when when you're in your recovery and going through so much pain, who were the people that were there for you?
I would say that, the significant other that I was with at the time,
Uh,
his name was Matt Myler, and I'm sure he won't be upset if I share his name on here because we have remained extremely good friends. He was one of my biggest rocks going through everything from bringing me snacks when I was in the hospital to keeping my mind occupied with bananagrams. I'm a huge nerd, by the way, so I enjoy playing games with some sort of mental component or stimulation to them to just going through self-talk and helping me to soothe my pain. He was truly and tremendously one of my biggest rocks. And the other component at the time was my parents. My mom that was working at the hospital at the time, would relentlessly check in on me, make sure I was okay, make sure I was fed, make sure I wasn't in pain. If I was sleeping, she would check in with the nurses to understand how I was doing. My dad would come to see me, and both my parents come from Eastern Europe, and I was more that cold, stern type of
mhm, mhm.
environment, but both of them showed an immense amount of care and compassion. And in addition to my parents and Matt at the time, it was all my friends and healthcare workers that stepped up, my colleagues from patient experience, the two individuals that I went to Iceland with. So it was really a tremendous effort by everyone that was there for me and helped me through the recovery process.
Wow. Yeah. Wow. Whenever I think back on trauma and I think about the sacrifices that my friends and family made, like your friends and family, it's a humbling thing, right?
Absolutely.
And yet if you would ask them, they would say there was nowhere else I wanted to be. And when we love
Exactly.
somebody, that's what we want to do. We want to be there with them.
No, for sure. And it's truly humbling, and to know what other people go through and the amount of time individuals sometimes have to face or spend in a hospital, right? And it's you really take things for granted in terms of even just showering on your own or getting dressed. You really take that for granted and until you need that help and support with you.
Hmm. I remember first time I sat on a toilet by myself was a momentous day,
Yeah,
right? First time
yeah,
I could shower by myself, momentous day.
yeah,
Wow. So,
absolutely.
so we're talking here now. We've got you're recovering in the same facility where you work, and you say your mom works there as well.
So she did, yes. She's since
Okay,
retired, but she did work in the same organization.
and that presents a whole different perspective, right? Of how do I perceive things not only as a patient but in the very facility institution where I'm working.
Right,
I almost feel like sometimes whenever I go into a clinical setting as a patient, as myself, I almost feel a little bit like a food critic. You can't not taste the food, right?
right,
It's sometimes hard to be totally in the experience because of your professional role,
right.
and it's hard for me not to think, well, that computer application could have gone a little more smoothly. That person at the front desk could have been a little nicer.
Yeah,
That procedure might have been a little too painful, but I before we get away too far from the clinical aspects, talk to me a little bit about the doctoral work now too, because this is something that has a great amount of implication for a lot of people, a great swath of society of North America, right, and across the
right.
world.
No, exactly. So I'm glad you asked. I'm currently completing my PhD in health management through the DeGroote School of Business at McMaster University. And I'm also part of the sessional faculty. So I do teach various courses within environment and health, and as well as some business health policy type of courses. My research interests, though, include, part of it is the health governance structures, the digital health technologies, genomics. But it also really stems to that fitness and physiology component of things. And that's a whole sort of separate career in my life. But in within my PhD, so I'm looking at complex chronic conditions such as obesity and type 2 diabetes, and as well as, the management techniques from that. And my research seeks to examine whether, government digital health-based policies, strategies, and approaches that are designed to prevent, control, or reverse obesity can be used to enhance public engagement and to improve population health and health systems. So within that, my focus on obesity, specifically looking at these various health services and policy frameworks that are related to risk factors with a focus on disease prevention. We're talking about control, we're talking about management at the local, national, and even international level. And the question of whether we can actually use digital health based policies or strategies and approaches can be used effectively to enhance population health and improve systems, it is an important question from the health systems and management point of view. So, understanding how and why these individuals engage with digital health technologies in an effort to prevent and control obesity is crucial to disease prevention at a population based level. So, this is a lot of what my research stems in.
Yeah. Wow. Wow. And so then turning the chapter to the next chapter of Nicole, what you touched on earlier, which is you're also a professional athlete.
So I am working on getting my pro card this coming June to officially designate myself as a professional athlete within the bodybuilding world. That is something that I have been working on for quite a number of years. But I'm well versed in physiology, kinesiology, and I'm working with Scripps Research Institute in La Jolla, California, which is one of the world's most renowned research institutes. And I'm working with some of the world's leaders in genomics to illustrate how digital health technologies can monitor those with specific health related conditions. So in tangent to that, I am a trainer and a coach, and I work with individuals from the very biomechanical levels, and I tailor each program in such level of detail to ensure that no individuals ever have any injuries, and clients receive the best possible results. So I think what makes it truly unique in giving some of my educational background is that I take the theoretical and I apply it to the foundational experiential part. So I include their genetic factors, individuals' hereditary predispositions, personal preferences, dietary restrictions, flexibility and range of motion, along with any health conditions that they may have. So I work down to the muscle fiber type that individuals have. And I use these advanced physiological and metabolic knowledge to help clients perform to their maximum potential. There's definitely a lot of opportunities that I will be excited to share within the next few months, but that will include working with some national sports teams, and as well as I'm in the process of signing a contract with one of the biggest supplement companies as their athlete. So that'll be taking place within the next couple of months.
Nice, nice. That's
Yeah.
that's that's super awesome. Congratulations on
Thank
that.
you. No, I appreciate that. It's
So
definitely the grounding part of my life that really keeps me, you know, sort of sane in terms of my output.
and we all need that, right?
Yeah.
We all need that, but I'm starting to understand more in my very limited knowledge about how much uh, of our past and our trauma does get stored in our body. And I'm working diligently these days to try to reverse some of that. I could probably deal with a lot of your expertise and knowledge in this area too.
Yeah, and happy to help anytime.
Excellent. And so then after we're talking about all of these things, and after you and I had a nice phone conversation, then you tell me that you also live with a visual impairment.
Yes. This
So,
is true.
so all of these things could be a full-time job or lifestyle. How do you sleep, or when do you sleep? I suppose would be the question.
Yeah, so I mean, sleep is very interesting to me. I sort of live off of the philosophy, you'll sleep when you die kind of thing,
Yeah.
but you definitely need sleep to function. It varies. Some days I will get 4 to 5 hours for nights on end. Some days
Hmm.
I'm lucky to get 7 to 8. And then, once a month I'll probably get a 12-hour sleep just to sort of catch up.
Hmm.
But I think it varies throughout the week. I'd say on an average I get about 5 to 7 hours a night, and I function quite well off of that. So I don't necessarily think I need more. Some days that I have less, I definitely feel it and it can impair my training and recovery. But overall, I'd say I still manage to get enough sleep.
It's just amazing the amount of things that you're doing. I've read several of your articles, both reflective and research evidentiary. I don't know what the proper terminology is
Yeah.
there, but the amount of things that you're doing and the people that you're helping is simply fabulous. And I can't thank you enough for being with me today and sharing your story.
No, and thank you. But it's really a learning process for me. I think, I appreciate you saying that I've been helping others, but I think in a way there's individuals that have also helped me. And every day I am learning so much. I think back to, we were talking about Maslow's needs and, sort of the psychological needs of safety needs, the love and belonging needs, the esteem, the actual self, actualization. But I think, perhaps one story that I will share is in my role that I had after the accident as working within a Health Links program, which basically targeted the highest users of the healthcare system. So within the province of Ontario, where I am, approximately 5% of the population uses 65% of our resources, right? So we're
Mm,
talking about those highest users that are constantly going to the emergency department, that have readmissions to the hospital, that are costing our system the most money. And myself and a care coordinator went to see a patient in their home in a quite affluent area. This individual had no running water, even though the house looked stunning from the outside. When we opened up the fridge, there was no food inside. There was barely any electricity because the bills haven't been paid. Hoarding was of a significant issue.
mm.
And, our first reaction was, we need to get this individual stocked with survival, with food, with running water so he can bathe and so he can drink, right? These were sort of our instinctual needs to get this individual help as soon as possible. But he did not want any of that because we were not focusing on his needs, we were focusing on our needs. The only thing that he wanted is to regain a connection with his daughter, and that was what was eating away at him. And until that connection wasn't made, he didn't care to eat. He didn't care to have running water. So I think, you know, that was one of the biggest learnings and turning points in my life, and he had taught me more than I could have gained in any textbook. And that is to really stop, pause, and think about the needs of others and what we actually need to do to address them and to stop and to listen to patients.
A root cause, right? The root,
Exactly.
right? We're trying to. I would agree with you. I would be the one who's like, okay, what we need to do now is move half of this hoarding out.
Exactly.
Get running water. No, no. What we really need to do is to find out a way for him to be able to have the one thing that's psychologically affecting all these other aspects of life.
Yeah.
So what did you do?
So we worked on a plan to have him reconnect with his daughter, and it started with us reaching out to her. And it took weeks, and we were finally able to build up that relationship. And until that was fixed, we couldn't touch the other areas of his life that to us may have been the most important, but to him were not, right? And I think as healthcare providers, we often overlook that missing piece of the puzzle is what are our psychological needs? What is it that we truly need in order to make a difference in our health? That sort of, again, it's that root cause of things, as you said.
So did that fix it?
It did. It
Did it? Wow.
significantly
Wow.
made a difference to all areas of
Wow.
his life.
That's amazing. That's
Yeah,
amazing. And wow. It's hard for I think maybe numbers get involved, but I think most people can understand when 5% of a population is using up 60, I believe you said,
65.
percent of
Yeah, or even higher in
65%
certain
of
areas, but that's on
resources.
average. Yeah,
Yeah, if we can just address those 5% at the root cause, maybe they don't end up costing the system 65%, right? Um,
exactly. And it's
it's
those with complex chronic conditions, right, that we're typically seeing, and that disconnect between the social and healthcare sector. So it's still very silent or siloed and fragmented. We often see individuals discharged from hospital, but them not having the appropriate community supports and resources in the community to actually be able to fend and have a sustainable approach to lead to these health outcomes or improvements. So I think that's a huge barrier that still exists. And I don't think, Hamilton or Ontario is unique to that. I think that exists everywhere.
just humanity, right?
Yeah,
We all have that need to belong and to exist peacefully and feel compassion from others and give that compassion. That's
exactly.
human needs, human needs.
Yeah,
Wow. Well, I feel like we could talk all day, but I'd love to be able to get your take on a few kind of rapid fire questions here in the
sure.
time we have left. Is that good?
Yeah,
Okay,
absolutely.
so let's think back to when you were 16 years old.
Okay.
And after school one day, you're hanging out with your friends or you're chilling out at home in your room. What is on the stereo? What kind of music were you listening to when you were 16?
I would say R&B, Rihanna type of music. I was into Eminem back then. Don't ask me
Mm-hmm.
why. I enjoyed I
Mm-hmm.
enjoyed the beats. Yeah, I would say some
Mm-hmm.
R&B, some
Yeah.
rap.
Well,
Yeah.
yeah. I, I used to make a joke in my keynotes that I was an OG because I
Yeah.
was living in when I was very, very into kind of LA gangster rap whenever it first came out in the mid '80s, and to this day, still it's on my playlist. It's on my
Yeah.
playlist.
Yeah,
So,
exactly.
another question for you. Let's say that you open up your wallet or your Cash App or whatever it is method of monetary distribution that you use, and you find that $100 Canadian dollars have been deposited in your account, but this $100 has to be spent on someone else today. Who do you spend it on, and what do you buy?
Hmm. Great question. You know what? I would probably have to say I would probably say my fiance.
Hmm.
Yeah, and I would say, we were both so busy lives. He's an emergency physician working with pediatric children, so I would say I would use it for something for us that we can spend together. We love doing escape rooms. Again, that's the nerdiness that comes out of us. So I would probably say, doing something that we can both enjoy each other's company and spend time together.
I cannot think that there would be an escape room that would be a challenge for you and your husband or future husband.
Yeah. Well, you know what? We still get stumped on some. Some of them are
Yeah,
extremely hard, but
yeah.
they're fun.
You both seem like very big problem solvers
Yes,
and
I think
able
we're
to think
quite,
through those things.
yeah,
And
we're definitely critical thinkers.
nice, nice. And so, my last question for you is: if you had the largest billboard, the biggest billboard on the tallest mountain on Earth, what is your message that you would want to convey to humanity?
That's a good one. I would honestly say is to be kind to each other. And I think with that, we never know what's going on in someone else's day. We never know what has happened to an individual. We don't know what it is that has made someone the way they are. We often ask ourselves, what's wrong with you? But really, we should be asking what's happened to you. And I think that was in a book that Oprah had written that actually was called What Happened to You. But I think it's really about being kind to one another. And so I think, everyone is fighting their own battle that you know nothing about.
Hmm.
So just remember to always be kind.
That is beautiful. That is beautiful. Well, thank you so much for spending some time with me and sharing your message and your inspiration and your work with the audience. Thanks a lot, Nicole.
No, thank you so much, Marcus, for having me, and truly enjoyable being here. So thank you.
Thank you. And that concludes this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience.